We now call upon the next speaker, sutureless, glueless pterygium surgery, the autologous blood method by Dr. Ankit Agarwal.
For giving this wonderful opportunity to present this study. The topic is sutureless, glueless pterygium surgery, the autologous blood method. Pterygium is an overgrowth of epithelial limbal tissue over the cornea in a usually wing-shaped pattern. It occurs mostly on the limbal side, nasal side, but can occur elsewhere too. The most common risk factors include UV exposure and outdoors work, thus it becomes very prevalent in India and other tropical countries because the patients here are frequently exposed to dust and UV light. Now the types of pterygium surgery grafting include no graft, that is Bayes-Serra method. This was the original method used, but it has a recurrence rate of more than 50%. Then there came amniotic membrane graft, which is a very good method, but now it is mostly reserved for cases with recurrent pterygium. And the most recent and the current method is autoconjunctival transplant, where the conjunctiva from the same eye containing healthy limbal stem cells is transplanted upon the Bayes-Serra from where pterygium has been removed. This was first described by Kenyon et al. In 1985 with a recurrence rate of less than 6%. Now the methods of autoconjunctival graft fixation include sutured autoconjunctival graft, glued autoconjunctival graft, and the latest technique which I am describing here, that is the autologous blood fixation. Now the purpose of this study is to describe a sutureless, glueless conjunctival graft fixation method in pterygium surgery. It was conducted in an eye hospital in North India. The number of eyes were 34, which were done during May 2023 to April 2024. That is a 1-year study. Now first, the pterygium is excised by a normal method. That is, the surgeon can have their own preferred method. Many people use a crescent, many people use scissors, but I prefer to use forceps to pull it out of the conjunctival area. Now I use a crescent to shave it out. The head area is shaved out from the cornea. The subconjunctival tissue, which is exactly the pterygium tissue, is removed. Leaving the conjunctiva above it. Now using a corneal burr, I'll just remove the remnant area and try to smoothen the cornea. An approximation of the size of the graft is done. And graft is taken from the opposite side. I try to take graft from the temporal side, not the superior side, because I try to leave the superior side for future surgeries like trap or SICS. Anyways, phacoemulsification can be done clear corneal, so there is no need to have a conjunctival graft from that side. The graft is fully excised properly and is put over the sclera, making sure that the limbal side stays on the limbus and the temporal side is similar. The graft size is taken slightly bigger than the pterygium and the underlying edges are tucked inside so that it doesn't move in the post-operative period. Now I wait for another 5 minutes to let the graft sit there. So autologous blood method of graft fixation gave wonderful results, and the patient, in all patients, and the patients were followed up for 6 months, had minimal recurrence. In fact, I did not find any recurrence in any of the patients. It's a wonderful cost-effective method, can be used because it uses fibrin from the patient's own blood as an adhesive. Thank you.
What was the inner thickness conjunctival autograph or a full adjusting the graft?
Yeah, in this case which I have shown, I have taken a full thickness graft, but in majority of my cases what I have done is that I have used a normal saline to in the subtenon areas to make the tenon and
It will
conjunctiva
not be
separate.
subtenon, it will be subconjunctival.
Sorry, subconjunctival area, so that to separate the conjunctiva from the tenon and take the conjunctiva only and remove the leave the tenon there.
So in the full thickness, are you saying that you had no graft contraction and scarring? Because full thickness graft is not going to stay, it is going to contract because there is fibrous tissue. It's not possible.
And that's what I'm saying is mostly I have taken all the only conjunctival grafts. This is the video which was actually the most clearest, so I showed this, but actually in this video I have taken the full thickness graft. But I really did not find much contraction even in this case
Do
because
you have post-operative serial photographs?
no, I don't have right now.
The documentation would be required when you make such a claim.
One more comment. You have not done the complete keratectomy in your patient. Is it complete keratectomy was done or the left behind some knowledge should be
I removed the pterygium part from the cornea and as much as possible I smoothen it out
Is
using
there any incidence of any recurrence in your patients?
none in my cases. That's what 34 cases I have done in 1 year with this method, and I did not find any recurrence amongst in 6 months follow-up for each patient I have done.